Hi friends, today I'm here to speak to you a little bit more about diabetes. When I tell the word diabetes, first it would be wrong if I don't tell you about insulin, which is the main hormone involved with diabetes. Insulin is a hormone produced by pancreas, which is a gland behind our stomach. This insulin works as a gatekeeper. What does a gatekeeper do? It restricts the people from going in and out of whichever place it is. Now, what does this insulin do? This insulin takes the glucose that is in the blood, which we get through food, and this works as a gatekeeper and allows the entry into the cells. So the food or the glucose which is got from the food is entering into the cells, which can be utilized as energy with the help of this gatekeeper, which is insulin. Now, if we consider there are mainly three types of diabetes if I go to diabetes in detail. First is type 1 diabetes, type 2 diabetes and the gestational diabetes. Type 1 diabetes is an autoimmune disease. Autoimmune means where your own body cells start fighting against your own body cells. Like, for example, it is like a fight in a household where the members of the same household, like husband and wife, fighting with each other. So it is within the same house, they fight. Same way, your own body cells fight with your own body cells. That is an autoimmune condition. Now, type 2 diabetes. Type 2 diabetes is a condition where there is insulin resistance and decreased production of insulin. What is this insulin resistance? When this gatekeeper is not working right, or it's a faulty gatekeeper, that is a condition where we get type 2 diabetes. Third one is the gestational diabetes, which is seen along with pregnancy. Type 1 diabetes and type 2 diabetes has signs and symptoms which are quite similar. Like, it can be increased or decreased weight. It can be normally an increase in thirst, increase in appetite, and polyphagia, polydipsia, and what we say is like tiredness is there, headache is there, and sometimes mood swings are there. All these things are seen along with the diabetes as signs and symptoms. What happens with the management of these signs and symptoms? The first and foremost important thing in case of diabetes is early diagnosis and right management. For early diagnosis, it is very important to go to your doctor as soon as you see any of these symptoms which are explained above. If you see an unexplained weight loss or a weight gain, or you feel that your mood is variating without any reason, or you think that your urination has increased, or you're waking multiple times at night for urination, in that case, go see your doctor. A simple blood test would be able to detect whether you are at risk of diabetes. There are a lot of blood tests which your doctor normally decides what to do and how to do. Once when you get diagnosed with diabetes, the most important thing is maintaining that or managing your diabetes. For managing your diabetes, as I told you, with type 1 diabetes, because there is decreased production of insulin, we need lifelong insulin replacement in the form of normally injections. Now the pens that are used are very, very fine and very polished. So it's not like, as painful as the old school where we used to, draw insulin from the vials into syringes and then push it into your, abdomen or your thighs or your hands. So the second mode is the type 2 diabetes, where I told about insulin resistance, where you have the faulty insulin. So it's not working right. So in this case, where we have to use, either tablets in the early stages, or at the late stages, we end up using the insulin. Now, it's very important, as I told you, to manage diabetes, because if you are not managing it right, what happens? It's complications. So if your blood sugar is not under control, then comes the problems. If you have your blood sugar monitored on a regular basis and make sure that it is within the normal therapeutic levels, there is no issues. So even though you have diabetes, you would be able to lead a near normal life rather than restricting your diet a little bit and making sure that you are active. Other than that, you are not compromising with your quality of life. But if you don't do the right things, there comes the problem, the complications. The complications that are normally seen with diabetes are retinopathy, where there is, like blurry vision, where because of bleeding, which happens at the back of the eyes. Then comes the kidney issues, where you end up going to dialysis on a long term, and then kidney failure. Then you get problems with your nerves, where you find decreased sensation in your, in your legs, or when you walk and stuff, you feel there is decreased sensation, there is numbness. Then you get problems with your blood vessels all over your body. Another important thing to remember is diabetes makes your immunity less. So your immunity is much lesser than that of a normal adult who is of your similar age, which means that you have to be careful and you're more prone to get more diseases from any other source. When anyone gets diagnosed with diabetes, one of the most common questions that I hear is, have I got to take this tablet lifelong? What is more important? Is the quality of your life more important, or taking a tablet is an issue? Weigh the risks and the benefits. If you feel that, taking a simple tablet is going to give you a quality of life, I think that is more important. Manage your diabetes. Go to your doctor every 3 months. Get your 3 monthly blood sugar checked, which is the HbA1c, which you might have heard about. Get it checked. Make sure you monitor. Make sure you keep your diabetes under control. As long as it is under control, there is no issues. The most important part in the fight with diabetes is preventing or prolonging the complication. As long as we are able to prolong the complications to another 5 or 10 years, then we are successful. Having a complications at the age of 40 and having a complication at the age of 60 plus makes a lot of difference in the quality of your life. So our aim in this case is to prevent the complication as much as possible. How is this possible? It is possible by keeping our blood sugar under control. Monitor it. Take your medications in the right way. Go to your doctor. Do the test as told. And that is how we are going to win the situation or win the fight with diabetes. Now, regarding prevention. With regards to type 1 diabetes, as I told you, it is an autoimmune disease. So it is our body fighting against our own body. So there's nothing that we can do in order to prevent it. Only thing is regular treatment with insulin, or making sure that you're monitoring it on a regular basis and getting regular insulin injections as advised by your doctor. Second is type 2 diabetes. Yes, here we can win by preventing the diabetes when we know that you are a pre-diabetic, or when you know that you are at risk of diabetes. Maybe it is because of your family history. Maybe it is because of the way your lifestyle is, or maybe because of your family history. If it is told that you are more prone to diabetes, just make sure that you go to your doctor, get it checked at regular intervals, and then get it under control. Your doctor might ask you to take the tablets. Take it in the right way. What can be done to prevent it? Regular good diet. Prevent the intake of processed sugars, or decrease the processed sugars. Manage or monitor the amount of carbohydrates that you're taking. Good vegetables and a healthy diet by eating the right amount of vegetables and fruits. And then exercise. I don't think that doing 30 minutes of walk for 5 days a week is not a lot to ask for a healthy lifestyle. Try to practice it. Try to practice this as a part of your day-to-day life. That is what is going to keep your complications away. All the complications that I told you, regarding to your eyes, regarding to your kidney, with regards to your blood vessels, with regards to your immunity, all these complications can be kept under your eyes, under your monitor, if you are managing your blood glucose level. So friends, let us join this fight by doing regular monitoring, following your doctor's advice, and by making sure you lead a healthy lifestyle. Stay healthy, stay happy. If you like this video, kindly subscribe.